Welcome back, folks, to Free My Pain Now with Dr. Matt DiDuro, and I'm really excited. We have a unbelievable guest. Let's bring him on, Samuel. Daniel Pompa, are you there?
Yeah, hi there.
Daniel, hey, welcome to our show, Free My Pain Now with Dr. Matt DiDuro, and thanks so much for being our special guest today. And I just saw you yesterday and this weekend, and for our listeners who don't know your story, and you're getting a lot of coverage across social media. About 3.5 weeks ago, tell our listeners what happened, Daniel.
Yeah, I was cliff jumping with some buddies, and we just climbed this cliff. It was pretty casual for us anyway. It was still 60 feet, and it was a little more sketchy than I had realized because we had to jump in a specific place, or we had to jump a lot further. And I ended up jumping at just the wrong angle. I never jumped a cliff before, and I jumped a little too far to the one side, and I came over kind of where I could see after because it was like kind of a blind jump where I could then see where I was going to land. And I knew I was coming up short, and I came down, and I was like, "Yep, I think I'm going to hit."
Oh.
And I realized I was definitely going to hit, and I landed about probably 2 or 3 feet short from 60 feet up onto straight rock, and I smacked my ankles first. At that point, I broke my right ankle for sure, possibly my left ankle, and then immediately my ankles went out from under me, and I landed on the back of my leg and tore my hamstring. And at the same time, I landed on the back of my leg, I landed on my butt too, and my whole butt was completely black underneath. Somehow I didn't break like my pelvis.
Thank God.
I don't know how that didn't happen. And at the same time, I put down my wrist too. So I think that kind of those 4 different points of contact between my butt, my ankles, my wrist, kind of dissipate a lot of the force. By a miracle, I didn't slip back, and hit my head. I'd be dead. It would have been lights out.
The force.
Broke my wrist.
The force of the impact actually broke your, I believe it's T10 and T11, correct? You had a compression fracture?
Yes, then the rest of that remaining force went up into my spine and completely shattered, or I guess they called it a transfracture, my T8 vertebra, and I broke 2 other vertebrae, and I broke 6 transverse processors, and I broke 3 ribs and punctured my lung. So by the time I hit, I kind of bounced.
Mm-hmm.
Then I was in the water.
Oh.
And I was like, oh, I'm good, My legs were still working, I had so much adrenaline going at that time. And I was treading water, and a boat pulls up, and they're like, "You good?" I'm like, "Yeah, I'm good." And they're like, "Can you swim to the boat?" I was like, "No." And at that point, I started to sink. And if that boat wasn't there, I would have drowned. So I kind of realized that, okay, this is kind of worse than I thought it was.
Mm-hmm.
Yes, that's what happened initially. In
this type of injury, and Samuel is a rock climber. He's our producer, and so he's cringing as you tell the story. But 75% of patients that have this type of injury are paralyzed. So obviously, were you flown out? Were you airlifted? How did you get to the hospital? They actually tell me what happened. How'd you get to
They had to take me. This was kind of the worst part because I was thinking to myself, okay, whenever the EMTs get here, I'll get morphine and then I'll be good. But they were like, yeah, we got to drive you to the other side of the lake. So, and then we had to wait for the ambulance. And so anyway, they drive across the lake, just bouncing. And, that was kind of excruciating. And then the EMTs finally arrived, the ambulance, 45 minutes later. And then they're like, before they can give me morphine, then they're trying to transport me to the ambulance. So they have to pick me up off the boat, move me to the stretcher without any morphine. It's this is the most excruciating thing. And then they have to pick me up on a stretcher and carry me up these flights of stairs. The one guy almost drops me. I start sliding off the thing.
Oh.
I'm about to lose my mind with these guys. But I just was like, it's not worth it.
Right. So you're in the hospital. There's obviously severe trauma. They have trauma surgeons, orthopedics come in. Your dad is a provider, and he's a really a world-renowned chiropractor, Dr. Dan Pompa, and so he goes into action. I mean, obviously, your mom and your dad were at the hospital. You guys had some decisions to make. So most people with this type of injury are going to have surgery, and you guys really, you had to pray on this. You had to really look what your options were, because
yeah. I mean, I was super adamant about not getting surgery at all costs. At all costs, I knew from the get-go that I'm going to try and heal this thing. Like, I don't want to put hardware in my back. I don't necessarily believe in that, but at the same time, there is a time and a place where it's absolutely 100% necessary. So we had to figure out, was that something that was 100% necessary to me? I mean, the doctors swore up and down that I needed this absolutely. There was no option. They wanted to go through and anteriorly, like through the front, like of my ribs, and they wanted to put like permanent hardware in there, like this cage-like thing around the one vertebra, and they wanted to put two 12-inch rods in, which would, and they wanted to fuse two below and two above.
So
the
T8
fraction.
T8 down to almost T12. You would have had like 4 segments.
So I think it would be T6, T7, T8, T9, T10. No, yeah. I think that would be it.
So, we were following your story on Facebook, and I was lucky enough to meet you back in early March. You were traveling, coming back from Patagonia with our family good friend Olivia D'Agostino, and you guys, I got to meet you. You stayed at our house for a couple days, and I really enjoyed hanging out with you and conversing. And you came into my office one day, and I was like, Daniel, you got to see this device I've been working with, the mini lithotripsy or stem cell machine that we call it. And so I showed you the one gentleman who had a stroke. And so we treated your neck, and you literally get off the table and he FaceTimes his dad and he says, Dad, you got to check out this technology. This will be great for your doctors. Tell him a little bit about your dad and what he's built, the centers he has.
Yeah, my dad, he works with, I guess, doctors and trains them on his protocols. And he has a few different groups, I guess you could say, like some where he works really closely with their health center, and other ones where, they just come to learn his protocols and his information. I'd say he's on the cutting edge of detox and fasting and what it really takes to get well. And really that we live in a very sick society, and that people don't realize what's really coming, and also how sick people really are today. So he's really focused on training these practitioners on how to treat these really sick cases, because he just can't do enough on his own.
Right. So he trained hundreds of other doctors through his Health Centers of the Future, correct?
Yeah, correct.
And I mean, yeah, he's really, I think, basically the father of functional medicine for a lot of doctors out there, and bringing that type of detox where, and people, like you said, they're crying out there. People are very sick. We did our earlier segment is just on people taking Humira medications, and they're developing these terrible septicemias and not doing, and dying from it. So there's so many sick people, and your dad had a great vision, and I was so grateful for you, because my vision is to get this device, this mini lithotripsy, out to the masses. And you made one call, Daniel, and your dad was like, okay, why don't you come up? So I got to present to some of his high-end platinum members in Nashville on March 24th of 2019. And, and then the next step is, we're presenting at his conference this past weekend, and some of his top doctors. The coolest thing about this, though, is your family decides we're going to release from the hospital. They take you home. They get a medical bed, and your dad has everything right there. So they're treating Daniel like, with everything that he uses in all his health clinics. And Daniel, I mean, you just broke your back basically in 3 different spots 3.5 weeks ago, and you were literally walking. And I mean, from the PEMF, the pulse electromagnetic frequency, to the oxygen you're doing, thankfully we were able to have the soft shockwave or mini lithotripsy used on you. I mean, you are a healing machine. Like, it's amazing. Tell me a little bit of what have been
a lot of different things, I guess, which having access to has been a huge blessing. And, we really believe in the body's ability to heal. And we can also enhance that naturally, with things that aren't necessarily, drugs or fake compounds, but that actually, are native to the world or to the earth. So, yeah, we've been doing a lot of different devices and really contrary to doctors' requests. I mean, they told me I'd be 15 weeks in bed, bed rest, 15 weeks. Like, I would not be up and moving whatsoever. That come back in 2 weeks, you'll need surgery, And so my dad and I were just like, I was like, there's no way I'm doing that right now. Like, I'm going to give it everything I have. We did an MRI. The ligaments were intact. So that was the catalyst that allowed us to not actually go to surgery because a lot of the ligaments were not ruptured. So that was why we could not, we could go without the surgery.
Well, that's
like
great.
You said, I mean, we've been using a lot of the devices, along with obviously, the perfect diet. When I first got hurt, we went straight into a fast to drop inflammation, 5-day fast, water fast. And then after that, we went and started stimulating the mTOR pathway to start growth. And we've just been dialing it all in to the best of our abilities, just keeping, my liver strong, kidney strong with different supplementation. The supplements are definitely a good list of supplements I've been taking for healing. And I think the devices have helped a lot. And I think some more than others.
And we've got about...
I have been having the TRT done on me twice a week, sometimes 3. And that provides pretty much, I'd say, instant relief. It does make a difference in the short term as well. And I know that a lot of the healing with the TRT is more after a few treatments. But that has been one of the bigger ones, I'd say, along with... Go ahead.
Well, we're gonna talk about that in the second segment. We're gonna have you on for the whole show today. We got 12 more minutes. We're gonna break for some of our sponsors, and then we'll bring you back right on. Welcome back to Free My Pain Now. This is our second half, and we have a special guest with us, Daniel Pompa. Daniel, are you still there?
Yeah, I'm still here.
So at the first segment, you were talking about, first off, nothing happens, as a coincidence, we find. But you get injured. Your dad is, president of the Health Centers of the Future, and you have all these different devices that you have at home that are utilizing. Let's just go through. I know your dad's got a beautiful cellular detox programs. He's got a lot of those. You had some oxygen you were using. Can you tell us about that?
Yeah, it looks like oxygen. It's actually the 4th phase of water. It's a device that converts regular water into the 4th phase of water. It's like there's like water, right, normal water, and then there's ice, there's water vapor, and then there's another specific kind of water that only is used in the cell, and it's called this 4th phase of water. And it's used to actually fold proteins, and it's essential for recovery and also healing. So that's one of the things I've been using is the phase 4 water device called the Ang3 or the Nano V. It seems pretty simple. You don't really feel a lot like you would with like the TRT or the PEMF, where like you actually you feel it working, but I believe it's a great device, pretty cutting edge.
Awesome. And then you had the pulse centers, the pulsed electromagnetic frequency. So you lay on that at least an hour a day. It's some mats and it.
Yeah. Anywhere from 1 hour to 3 hours I use on the pulse, just mostly for my back, but then I'll also use it on my hamstrings, and my wrists, my ankle, is those things also.
Yeah,
so I pulse consistently.
I was surprised you had a brace on one of your wrists, and you didn't have any You didn't have casts on your ankles. You have a brace for your spine to keep you upright as you heal, which was cool. But I mean, your mobility. I saw you dancing on Saturday, buddy. I mean, what are the doctors saying? I mean, you're probably 10 weeks ahead of where everybody thought you would be. What are the doctors saying?
I'd say at least 10 weeks. I mean, we went in for that X-ray to see if I need surgery or not after 2 weeks. And the doctors were blown away because they said even with surgery, I would 100% always have the kink that was in my spine. So after I got that chance fracture, my spine kind of collapsed, So it's like I had this kink in it, or kyphosis. And they said it would never go away even with surgery. Even if we put the rods in, and we did all this, you still have the kink. And we got the X-ray back. Kink was gone. And I was healing up. We could see all the bone remodeling, which was pretty freaking awesome. I mean, say it was a miracle.
Yeah, and we'll show our listeners. We'll have a link for these pictures, these pre and posts that are amazing after 3.5 weeks. I've never seen anything like this in 25 years. And you also had used exosomes. You said you had about 55 billion the first time. And can you tell us what exosomes are?
So exosomes are the precursor to stem cells. So like if you get injected with stem cells, the stem cells release exosomes over a certain period of time. But you can also use just exosomes to stimulate healing. So it's similar to stem cells. Depending on the person, they can be more effective. They cannot, every situation is different, but either way, they're kind of roped up into the same exact category as stem cells. I think my dad prefers them. So that's what we did. His friend in Mexico sent us exosomes that were actually able to be expanded because in the United States, it's illegal to expand stem cells. It becomes kind of like a drug. At that point, the FDA says, you can't do that. But in Mexico and in Panama, you can expand them, grow them. And then he's like, I'm pretty sure like the best in the world at actually consolidating, I don't know the word you use, but actually like compacting these exosomes into the smallest liquid form. So yeah, we were able to do 55 billion after the first week. So a week after the injury, we injected 2.5 cc's of this fluid of exosomes. And then about 4 days ago, we did another 2.5 cc's, which was another 55 billion, which automatically, like the first time I did it, my spine, it looked like I had a backpack on. Like you couldn't see my ribs, you couldn't see my spine. And this was right when I got home from the hospital. You couldn't see anything. The exosomes. Next morning, you could see my spine, you could see my ribs. So it like down-regulated the inflammation instantly. We got a huge anti-inflammatory effect from the exosomes initially.
Well, and the thing I like about the TRT device, or what Dr. Jason West refers to as the stem cell machine, is that it helps actually circulate your own exosomes, and it helps bring those resident stem cells out of a dormant state to actually trick the body into keeping the healing process going. And like you said, the short term, Daniel, is yes, pain relief, decrease in inflammation. But the long term, what we're finding in our studies is that 8 to 10 weeks after the fact, you're actually having your own stem cells migrate to that area, which is key for your healing. Yeah. So you're getting you're getting TRT 2 times a week right now. And I know Miss Cassie Ray, one of my partners, and Brett, her brother, are out there treating you. They're on the ground and helping. You were saying it gives you almost near immediate relief. Tell us a little bit about that. And I'm pretty amazed you only really had to be on any type of strong medications for like the first 3 to 5 days after this injury, right?
Yeah, that's true. Yeah, the TRT's been awesome. They've been coming twice a week. And this past week we did three sessions because I have so many different injuries to work on. So you can only do so much of it where it's actually effective. So yeah, the TRT is pretty awesome because like you were saying, it hits the cell membrane sheds that outer layer, right? And then exosomes are released. So you're getting exosomes without actually having to inject them. which is pretty freaking awesome.
Yeah.
So the more the better at this point, obviously. And obviously there's certain things that you can't really quantify between the difference of exogenous exosomes being like injecting and the ones that are being created from the device. So
the autonomous ones. The autonomous are our own bodies, and the exogenous are the ones that we're injecting into you. And I mean, it's just like people have come out of the woodwork who just love your family, who've been trying to help and present to this. I like to refer to that study in Austria, Daniel. Every patient in Austria, they have one of these TRT devices in all 11 trauma centers across the country. And within 72 hours, patients with spinal cord injuries in Austria will have this treatment done. And in a small pilot study, they've had 50% reduction in paralysis. And I mean, I know the day it happened, I was texting with your father, and, as soon as we could get you out of the hospital, we actually started doing the treatments. And I'm just so impressed how, it takes a village to take care of, and the village has all risen up to really come to help speed your healing and really work with your family. So it's pretty awesome.
Yeah. Yeah. So, everyone's been very, very helpful in all of it. And, more than generous. So I'm very grateful for all the things that obviously I've had access to. And it could have been a lot worse. I mean, all of it could have been a lot worse.
Exactly.
Like you were saying, the painkillers, and that could have been another big issue. I mean, it did for the first few days, like stop my bowels in the hospital. So at that point, I was already sick of painkillers. I was like trying to do everything I could to get off them. So that became a big motivation of mine, especially knowing that painkillers do slow the healing process, and they do affect how well stem cells work. So I wanted to get off them quickly. So between Kava helped a lot with the pain, believe it or not. And I was able to get off higher levels of oxy a lot faster with Kava. And I would take CBD too. I don't think CBD helps a ton with the pain.
It is a neuroprotectant and a natural anti-inflammatory. I'm not sure that it's just alone is as good with pain, but
yeah,
it's kind of wild that you had to find your calling from jumping off a cliff. But I saw it in you even months ago, and it's a pleasure to have you on. You're such an articulate guest, and for everything you've gone through. And we do have an opioid crisis in America. We're losing 1,000 people per week. And some people, they can get addicted within, the first 2 or 3 days of taking it. So the message we always tell our listeners is, hey, if you are prescribed that, and your family did it right, you said, hey, when is my end date, right? Is it 3 days? Is it 5 days? Is it 7 days? And as soon as you were able to get to that point, you started reducing that, right?
Yeah. And we used, I was trying to get off as fast as I could, just because I knew they were taking an effect on my kidneys or my liver, so everything. I think I was off the majority of oxy within the first week, and then by week 2, I was completely off all Tylenol. But I was still using like CBD suppositories. I think something that helped a lot also was kratom.
Yeah. Oh, kratom's supposed to be wonderful.
Kratom. But yeah, that's like, it kind of has opiate effects, and it's a plant. It's not as obviously strong as painkillers, synthetic painkillers, but it did help a lot.
We're going to have a whole segment on natural remedies for pain relief. So I'll have you back on next month, Daniel. We want to check in with you every few weeks, and just you've had so many friends and families that have been praying for your speedy recovery, and it's just awesome to see it work. And it was such a pleasure to be out there with your family this weekend, and thanks for taking the time to share this healing story with us. And God bless you, and keep up the good speed and healing.
Hey, thank you so much, Matt, and I appreciate everything you've done for me too, and couldn't have done it without everyone's support. So,
all right, buddy.